In this video, we're going to cover a question that we get a lot, which is what is the difference between an orthopedic spine surgeon and a neurosurgical spine surgeon? One of the questions I get a lot from patients is what the difference between an orthopedic spine surgeon is and a neurosurgical spine surgeon. For that, I think you can get a variety of different responses, so I'm just going to give you my perspective on it. Obviously, I'm a neurosurgical spine specialist, so I have a bit of a bias when it comes to that. Having said that, I'll try to be as objective as possible. So orthopedic spine surgeons are people that start their training after medical school with generally a 5-year residency in orthopedic surgery. So residency is specialty training that happens after medical school, and they are different lengths for different subspecialties. So for orthopedic surgery, it is generally a 5-year residency. For neurosurgery, it is generally a 7-year residency. In terms of the types of things that people do in those residencies, they're different. So in neurosurgery, we do brain and spine surgery. We do some peripheral nerve surgery as well. But one important distinction is that during the course of 7 years of residency, a lot of what you do in training is in fact spine surgery. I think it's fair to say, depending on the program, about half of the cases that you are trained in are spine cases. So coming out, you've often done hundreds to even 1,000 spine surgeries in training as a neurosurgeon before you've done a fellowship. In orthopedic surgery, they tend to focus predominantly on bones and the extremities, and they do get exposure to spine surgery in residency as well. That also varies depending on the program, but can be 3 months or 6 months of spine surgery during the course of it, and it's often a pretty immersive experience, but not necessarily the same volume that you get over the course of a neurosurgical residency. So coming out of residency, you don't necessarily have to have done a fellowship. A fellowship means that you have really specialized in one specific domain. So people that come out of neurosurgery can go into vascular neurosurgery or functional neurosurgery, or they can go into spine surgery. Similarly, in orthopedics, people can go into joints or go into sports or go into spine. So spine surgery is a fellowship that is available to both neurosurgeons and orthopedic surgeons. So the question becomes, what's the difference? And there are a lot of programs, like I went to a program at Cleveland Clinic where it was really 50% orthopedic and 50% neurosurgery. So the fellowship was very similar. I don't think there's a huge difference in terms of the 1 year of fellowship between the different types of experiences. That's a lot more program dependent in terms of how much volume, how many different people you work with, the types of cases you do. All of that stuff can vary pretty significantly from one fellowship program to the other, but it tends to generally be 1 year of complex spine fellowship, a lot of time in clinic, a lot of time in surgery. But I think really the big difference is that for a lot of the ortho residents that come out that go into fellowship, they get the bulk of their orthopedic spine training or most of their spine training during fellowship. For neurosurgery, we really treat it very much like a finishing school. Like when I went to my fellowship, I did not do anything in my fellowship I had not already done a number of times in my residency. It was more about learning different ways of doing the same thing. Now, having said all of that, that's just kind of a background on the training that goes into becoming a neurosurgical spine surgeon or an orthopedic spine surgeon. There's some distinctions in terms of duration, and there's some distinctions in terms of how many cases people will have done in spine during the course of their residency. But there are a couple of other distinctions as well in terms of the types of cases that people do. In neurosurgery, we tend to operate on the spine and the spinal column, doing cases that involve the discs and the bones and deformity and alignment and instability and things like that. But we also operate on the spinal cord and the spinal nerves. So the spinal cord has a lining around it called the dura, or the meninges. It's one of the layers is called the dura. And intradural abnormalities, so that can be tumors in the spinal cord, tumors inside the dura but outside the spinal cord. All of those are things that only neurosurgeons do. Orthopedic surgeons generally will not do intradural work. So maybe a simple answer to this simple question is really that a neurosurgical spine surgeon really does everything in the spine. There's nothing in the spine that I don't do. I do deformity, I do degenerative cases, tumors, I do spinal cord work, etc. Orthopedic spine surgeons do everything that is outside of the dura, so there is definitely a subset of things that they do not do. Now, having said that, if you're a patient and you have a problem that orthopedic surgeons do, So maybe you need a cervical discectomy and fusion or a lumbar laminectomy. Those are surgeries that both orthopedic spine surgeons and neurosurgical spine surgeons do all the time. So it's not so critical what people's background is. It's important that the spine surgeon that you're seeing feel comfortable with the spine surgery you need. And it may be that they do the case that you have frequently or infrequently, and that probably dictates whether it's a good fit or not better than anything else. I would say many of my friends are orthopedic spine surgeons and incredibly qualified, but like anything, some surgeons are better than others, and what's important when you're looking for a spine surgeon is that it be a surgeon who is very comfortable doing the surgery that you need done. As long as you've figured that out, you're in good hands regardless of their background. This was really meant to be an explanation, since that's a question that comes up a lot. There are differences in training, there's differences in the scope of what people do, but at the bottom line is really that it's important you feel comfortable that the surgeon you have is comfortable doing the surgery that you need. I hope this has answered that question. If you have any other further questions or comments, I would love to see them in the comment section below to make sure that I'm really kind of fulfilling what it is that you guys really need to hear. Thank you.